thank you for joining once more in CAF Informed. Today, we want to share with you good information that you will forever be thankful. I want to make sure that you share this link. If you haven't done that, make sure that you share with your friends, with your family members, because today we're going to be learning about environmental health. And this is an issue that you and I should be very concerned about because of all the things that are going on. We stay more time at home, inside our homes, and we want to make sure that your environment is clean and is healthy. Today we have my friend, Dr. Lesliam Quiros Alcala, who's going to be with us, sharing with you really good information. She is an associate professor at Johns Hopkins University. I had the opportunity to work with her in the past when she was working for the University of Maryland in a number of research, and she's gonna share with you a lot of information. So I wanna make sure that you take the time, that you learn, and also if you have questions, you can type those questions, put it right below, and we'll be happy to follow up with you. So Lesliam, welcome to CAF Informs. Tell us a little bit about yourself and the work that you're doing at the Johns Hopkins University.
First of all, Walkiria, thank you, and thank you, CAF, for extending this invitation and providing this platform so that we can inform our communities who need this information the most. So like you were saying, I'm at the faculty at the Johns Hopkins Bloomberg School of Public Health in the Department of Environmental Health and Engineering. And a lot of my work, I'm an environmental health scientist by training. And so I wanted to back up a little bit and say, you know, what is environmental health? What do we mean by environmental health? Because I think one of the goals of today's session is basically to raise environmental health awareness. Environmental health in our field is very multidisciplinary. What we study is basically how different environmental factors, and these factors can be chemical, right? Such as the chemicals that are in our personal care products, or the chemicals that are in our cleaning products that we use, or chemicals that we even use to sanitize or disinfect indoor spaces, as well as these factors can be physical, such as noise or radiation, as well as biological, such as different viruses, including the coronavirus, and how these factors could impact health, as well as we also study what are the sources of these different factors so that we can then design and implement interventions that we can reduce exposures and also minimize the risk of any potential health consequences that may occur as a result of these exposures, which is a lot of what I do. And I focus on not only I study exposures in different consumer products. I've studied pesticides before and still do. And I'm looking currently at the different effects of chemicals in personal care products and their effects not only on children's health, but also in worker populations, including hairdressers, which is what I'm doing right now. And I focus on vulnerable and susceptible populations. What do we mean by vulnerable and susceptible, and who is vulnerable and susceptible? What I mean by that is I focus on worker populations, pregnant women and women of reproductive age, children, low-income populations, as well as minorities. And a lot of these may be in combination, right? And the reason why these populations are more vulnerable and susceptible is for different factors. It could be by nature of where we live. We could live near, polluted industries, for example, or near highways. Or, for example, children are very vulnerable and susceptible to chemical exposures or other exposures as well because they're still growing and developing, right? For example, a child's respiratory system doesn't finish developing until in early adolescence. And so exposures during this critical window where the child is developing the respiratory system could potentially have long-term health consequences. And so what I study is I try to look at what are the sources of exposure to these populations. Why is it that a lot of minority populations are more highly exposed and suffering elevated exposures to many of these chemicals, and what potential health consequences we could expect so that we can minimize exposure by, like I said, implementing interventions that are also culturally appropriate for these different populations.
So let me thank you. It's amazing the work that you guys been doing, and I know in the past we did some kind of research together, specifically to focus on women that works in hair salon. And the focus was with African American and also with the Hispanic community. And so those are the kind of things that sometimes we never pay attention. You know, what are the chemicals that are in the shampoos that we use, or the you know, when we walk into those places, are we sure that the environment is healthy, you know, for myself or even for the workers? Can you share a little bit about, you know, that research? I know we had the opportunity to collaborate almost 2 years ago, and the research still in development, but if you can share some of that information to those who are listening.
Sure, absolutely. And I want to also thank you for all of your help in that project, because it's community participation and having community partners is very essential to this work, especially when you're talking about populations that are understudied and underrepresented, which tend to be low-income populations and minority populations. What kind of drove this research is that there is data from the CDC, the Centers for Disease Control and Prevention, that indicate that minority populations, particularly African American and other minorities, Latinos, are experiencing higher exposures to some chemicals, including those that are present in things such as personal care products. And so what we wanted to see with this project, and it's still ongoing, is whether exposure among hairdressers, particularly minority hairdressers, are higher than women in the general US population, in order to see what are some of the interventions that we could design or implement to minimize these exposures, and at the same time minimize any risk of potential long-term health consequences. Because we are finding, you know, there are emerging studies showing that some of these chemicals could have an impact on different health effects, such as respiratory or reproductive problems, etc. And so we are finding that hairdressers have higher exposures to some of these chemicals compared to other women in the general population. Research is still ongoing. Oftentimes, what is challenging in our field is that, you know, we're all exposed to chemicals in our environment, from what we breathe, from what we consume and eat, from what we put on our bodies. And so often we don't know what the long-term health consequences are, right? So a first step is finding out what does the exposure look like? Who is more highly exposed? And then diving in a little deeper and saying, okay, what kinds of interventions can we do to lower these exposures? And also, what are the potential health consequences of some of these chemicals? Because, for example, in the US, personal care products, they don't have to undergo safety testing before they're put out in the market. So the onus is on us scientists to figure out, are they a potential threat to human health through conducting studies? And oftentimes these studies take time, they take money. And so the idea and key here is prevention as well, right? And prevention of long-term health consequences, and also minimizing our risk, because we can never get our risk to zero, right? But we can minimize it by changing our behaviors, becoming educated, and becoming aware that the chemicals that I use or may come into contact with in our environment could potentially increase my risk to different health effects.
Wow. So I want to, you know, we live in right now the pandemic, and I want to just, you know, finalize this interview with what are your recommendations now that we are inside our houses for so long, breathing the same air, cleaning, using so many products? Like, what is your recommendation to those who, I mean, all of us, everybody is a global thing. So, you know, when it comes to the environment, why should we be paying attention?
I think it's key, whether we're under a pandemic or not, to be conscious of what chemicals and how we're using them, right? We need to be conscientious of misuse and overuse of chemicals in our household, whether it's chemicals we use to clean our homes and our indoor spaces, as well as chemicals that we may put on our bodies for personal hygiene purposes. It's very important to read labels. I can't emphasize enough wearing masks when we go out of our homes to minimize the risk of coronavirus to others and to ourselves. And read labels and instructions when we're using cleaning products at home. You don't always necessarily need harsh chemicals in our homes to clean. There are, you know, products that, or cleaning products that you can make on your own as well. And I think the key here is, you know, not to overuse and misuse products inside, to make sure that the areas are properly ventilated, you know, opening up windows when using products, not misusing them or overusing them, being really careful, especially if we have household members with pre-existing conditions such as asthma, for example. Be careful of what we're using indoors. Again, making sure that the areas are well ventilated. And, you know, we're taking proper precautions indoors as well as, you know, when we leave our home, because the worry is, okay, in my home, I know what I'm doing, I know who's around me. So I think that also highlights the fact that it's really important what you do once you leave your home. So it's also taking precautions when we go out, if we have to go out, and following whatever the CDC guidelines are at the time. And these may be constantly changing depending on what the situation is in our given county of residence, for example, right? So those are some of the things that we can do.
Excellent. Well, you heard my, you know, Lesliam and Dr. Lesliam Quiros Alcala, who is an expert and he has so many years of experience, and he's been working so hard to ensure that there is awareness about environmental health. You know, so many of us, sometimes, as I said, we didn't grow up being aware of the impact of, you know, some of the things that are around ourselves that can somehow, you know, challenge our life, our health. And so these are the kind of things that you need to learn. I will, you know, encourage each and everyone that is listening, if you want to learn more about this work that you know, we're doing in collaboration with CAF, go to our website. We got a lot of information there. Also, if you are interested in bringing a workshop on environmental health issues, we will be happy to come and bring it. We work with a lot of churches where we're able to bring this information, also with the schools. But we want to be part of the movement where we actually empowering people with information, and we want to change one life at a time. And I'm glad that you is there listening, and I'm so happy for, you know, the work that Lesliam is doing for the minority community, for those who sometimes are more, you know, sometimes are exposed to a lot of these health issues that don't know how to go about and mitigate them. And so I appreciate this work that you do, all this research that you've been doing in order to inform and in order to make sure that we get, you know, the appropriate care that we need to have. So go to our website, www.mycaf.org. Again, www.mycaf.org. And you know, we have our Department of Healthy Families. There's a lot of information there. So just go and get connected with us. You can also go to Johns Hopkins University website, and you'll find Dr. Lesliam Quiros there, and be able to follow her research. She's amazing. But also you'll be able to, if you are part of CAP, if you subscribe, if you connect with us, we'll be able to connect you with all this information, all this great research that sometimes we get to collaborate with Dr. Lesliam, and you'll be able to read all about it and see the impact that it. So go to www.mycaf.org, share this information, you share or listen to this interview, just go to the YouTube channel and you'll be able to find it. That's MyCaf. Lesliam, thank you so much. I am forever grateful for the work that you do and your commitment that you have for this community. Thank you we are very, very proud to have you know, a Latina in the position that you are at Johns Hopkins University and the work that you're doing, not just for the Latino community, but for everyone who, you know, all the underserved community, as I mentioned.
Thank you so much for this invitation. It's been an honor and a blessing to be here with you and with CAP in what CAP represents to inform our communities. And I look forward to many more years of making a difference in our communities and how we can better inform them and being connected. So thank you for this.
Thank you, Leslie. Remember, if you haven't done your census, go to census2020.gov. We only days away. Remember, by September 30th, this is over. So you know, you're not gonna see the banner in the back, which you've been seeing it for the last year and a half. Every interview that I have, you're gonna see 2020 census. So we're only days away. And I wanna make sure that if you haven't done your census, go to 2020census.gov, fill it out. It is a civic responsibility. Also, if you wanna buy a home, you don't know how to do it, what to do, go to mycap.org and you'll be able to take our first-time home buying seminar. It's completely free and it's virtual, so you don't have any excuse. You can just go, take it, and be able to be informed. So I will repeat again, www.mycap.org, and I look forward to seeing all of you next Thursday. Make sure that you share and that you connect with us again next Thursday. Thank you, Leslie, and thank you everyone for joining us. It will be until next time. Thank you.